successful. We built up the joint prevention and control mechanism, that is public health problem solved as a guidance and public resources as basic guarantee, and to do the social mobilization. And we need to continuously enhancing the risk assessment as our core technology. And also because of this experience, we think there are 4 parties that is very important. One is the government, the other is sector, and the third is institute. The rest is the individuals. So we have 5 very important core competencies. One is for timely, comprehensive surveillance and timely communication with different parties, and risk assessment with scientific evidence, and quick and effective response, and to do the accurate intervention based on scientific evidence. So we think this 3 circles is very important. And here are some cases for the fighting against infectious disease. One is for avian influenza. We have already set up a very comprehensive surveillance network within our province, not only including the hospitals for the symptomatic surveillance, also including the occupational special occupation that are exposed to the poultry, the live poultry, and also the live poultry market environment surveillance. And at the same time, we do the gene sequencing in our lab to trace back where the virus comes from. Here are some photos showing the results and also the points that with our surveillance networks. And over there, we firstly raised the policy for effective controlling the live poultry infected avian influenza, because that is the conduct cleaning once a day and generally cleaning once a week, temporarily market closure once a month, and also 0 poultry storage overnight in the live poultry market. And also because of this, many of these policy are work and collaborate with the different sectors and the government together. So the government also noticed that the epidemic is very important. So they need to pay attention and collaborate with our public health department. So many government leaders, like this one is the Deputy Director of Guangdong Province, Deputy Governor of Guangdong Province, and over there it is the public health professionals, experts, and with clinical experts. These 2 are also work closely together during the SARS period. And this one is for the dengue fever. Do you have dengue fever? Oh, really? So here shows the way that we conduct the prevention and control of the dengue fever. We work with new technologies and different areas of experts together, like relying on the bioinformatic technology to improve the scientific base capacity. Here is some of the photo that we take from the field, some from the laboratory, to do the surveillance on the mosquitoes, to inspect that the mosquito-borne disease, because dengue fever is a kind of a mosquito-borne disease. So we think control the mosquito is very important point for fighting against epidemic. Also based on the joint prevention and control mechanism in the second line, and the last is for the working with the new inspection prediction models for the dengue fever based on the density of the mosquito and also the climate, some other factors together with the statistic model, and also to do the surveillance on different areas to conduct that. And over there is a sprayer. The sprayer, just like the one shown over there, for the spraying for the mosquito side. And on the left is the very successful fight against the Middle East respiratory syndrome for the MERS case. In 2015, we have 1 MERS case imported from Korea. So at that time, we conduct and test the public health emergency response system within our province. We think we did a good job at that time, because you can see that after we received the notice, within 2.5 hours, we have already found the patient. And then within 1.5 hours, we also transfer the patient to the negative pressure isolated hospital rooms to do the treatment. And also within 7 days, we finish all the close contact, check for all the close contacts. And within 4 hours, we already can diagnose that this is the positive cases. So our staff and also our leaders think this is one of very important and successful case for the EID capacities within our center and also our province, because we collaborate with Huizhou city together and also Hong Kong together. That is the whole route. This patient travel around from Hong Kong to Shenzhen and Huizhou city, then to Huizhou city. That is the whole route they walk through. Okay. Over there is different kinds of disease control and prevention. This one is for the vaccine. Vaccine is over there. Then there is a
We are at the Center for Disease Control of Guangdong Province here
we also have smallpox
in China.
And polio, and also the Japanese epidemic, Japanese encephalitis, and rubella, measles, hepatitis A, and hepatitis B.